2017 was to map the resources that the different centers have for EEG, and we have delivered that, and I'm sure all of you have seen the, thank you, all of you have seen the report that Judith circulated. So based on that mapping of the resources, I would like to talk to you today about the projects that we are currently working on and projects that we are planning. And this is the overview, so I'd like to talk about the EpiCARE implementation of SCORE, and as you well know, SCORE is the standardized computer-based organized reporting of EEG. Then about the multi-center study that we are about to start about source imaging, an inter-rater agreement study using SCORE that we discussed, and then in the end Milan will tell us about EpiCARE, who is a project actually. So about the implementation of SCORE for EpiCARE, this is the status. So in January we established the database, and currently now we are testing the beta version, and you kindly submitted EDF files just to try how the uploading process and the integrating of the files into SCORE works. Most of the files uploaded and opened very nicely in SCORE. There were some problems with a few files, and currently we are debugging it. Now, there are some questions about this patient identification issue, and as in the work package 3 we have previously discussed, there is this issue that this is actually a different IT platform than EpiCARE itself. So as it is now, we have pseudo-anonymized EEG samples, and in the future, from next year, we will have the technical possibility of having also videos too. Again, how can you de-identify a video where you can see the face of the patient? But our thought was to use the same strategy as journals, scientific journals use. For example, you can submit to epileptic disorders videos where you can see the face of the patient if the patient signs a specific consent on that. So probably we would link uploading videos to those patients who sign a specific consent, allowing that the video will be uploaded on this. Now, this IP platform is password protected, individual password, everything is done, is tracked, is logged, it's encrypted. So I do believe that this lives up to the standards of patient data security. But again, it's a question of who owns it and whether this is officially a part of EpiCARE, or how we will solve this legally in the light of the new directive that comes now in May. Now, each patient in the database has a study ID number, and our suggestion was to compose this from the EpiCARE patient ID, and I understood yesterday we reached a consensus that we will have a registry, so we will use the same patient ID that we will enter in the EpiCARE registry, and then underscore and the recording number, because some patients will have several recordings that we will upload, so this will be 1, 2, 3, and so on. And then there are some other entries in the database, and then the suggestion was that for the first name we just put again the EpiCARE patient ID number, and then last name will be the recording number. And then concerning the date of birth, we would set it to the 1st of January of the actual date of birth. This is again a pseudo-anonymization, but we need this to calculate the age of the patient. And then the recording date, that will be set to the 1st of the month of the recording in the real recording year. But again, this is a protected, closed database, so only EpiCARE members will have access to this. But we will have to see in detail how we will make this compatible with the regulations that are soon coming. Now, within the SCORE, we have the possibility of labeling each recording for specific projects. So if you tell me that you want to use the database for a project that you designed, then I can put a label. For example, for a project, this would be study 1 and 2 and 3 and 4. And then when uploading the data, one can label a recording for a specific project or for several specific projects, and then you can use filters. So if you want to do a data search, you can opt searching through the whole database, or restrict it to those that are flag number 1 or 1 and 2 and so on. Any question concerning the SCORE EpiCARE platform or suggestion? If not, then perhaps we can move to the next topic. So we plan a prospective multi-center study on EEG, automated EEG source imaging. The acronym is PROMISES. So there will be 2 companies who will do the automatic source imaging. They will do it for free for you. It will be Epilogue and Beza. And then I've sent you the draft of the protocol. So has everyone received the draft of the protocol? Because you did send it to all center leaders, and I've sent it to everyone who is on my work package 4 list. So is there anyone who has not received the draft? Okay. So the deadline for responding is actually Sunday next week. So in 8 days. So far, I have received responses from 9 centers who has committed. So this is a very, very short description of the project. So the idea is that you would upload to a secure database, again, anonymized data, which are long-term monitoring data and diagram files of the patient. And then you will receive in return the source imaging from the 2 centers. And then there will be 2 parameters that we monitor for outcome. One will be the clinical outcome, one the post-operative outcome 1 year after the operation, and the other will be the clinical utility. So what is the impact of these sources, the source images that you will receive? What's the impact of them on your decision-making process? Yes. Yes.
Because I had some questions
yes.
on electrophysiology.
Yes.
The answer should be yes or no without having the ethics committee, because the time was too short to ask for all the agreements.
Yes.
So
that's the timeline. So one question was also about the timeline. So if you think that there is one specific or several specific issues on this timeline that would be difficult for you, or it's too early, then please include that in your answer.
Basically, it's about the ethics committee. I mean, it's not other things.
So one of the tasks is obtaining a permission from ethics committee. Now, in some countries, this is a question of weeks. In other countries, this is a question of 4 or 6 months. So that's why this is a question. So this is a suggested timeline. If you have any concern with that, just include it in your answer.
Thank you.
No problem. And then this was the suggested timeline, but again, this is merely a suggestion. Yeah. Any other question or suggestion concerning this PROMISES study? Now, my hope is that this will really provide compelling evidence about the accuracy and clinical utility of this study. So we plan 250 patients, which is impossible gathering from one center. That's why we need to do it. And I think EpiCARE is an ideal platform exactly for such studies.
Is there some budgets for this? Are there some budgets?
Well, to come back to the question that you showed, how do you do projects with no money? Well, actually, the companies do this for free, and then there's your own resources in uploading the data and then interpreting the data. But again, the uploading is very user-friendly. So again, this is a secure data encrypted site where you upload the anonymized data. It's really Ctrl-C, Ctrl-V, so it's not too much. And then you will need to interpret the data. So I would estimate that at most your time spent on one patient for this project would not be more than 3 hours. And then we ask 20 patients from you. So it's 60 hours totally. So this is absolutely a low cost, low budget project. Okay, now we discussed yesterday to get started with using the SCORE template to specific projects, and then one would be an inter-rater agreement study, and Silvana Franceschetti yesterday suggested focusing on photosensitive epilepsy and to see how we score the photoparoxysmal responses. I don't know, Silvana, is Silvana here? Yes.
Yes.
So we discussed that you will send a proposal to the group, and then we will get started later this year. So please.
Just to try to have the same ability to apply score in a specific pattern, because it's not so easy. I think that a typical genetical pattern, such as photosensitivity, that is present very differently in different conditions, can be a trial that can contribute to understand, because there are few literature data. Generally the patient is described as photosensitive, but nobody explains what kind of photosensitivity, what is the pattern, what is the question, what is the duration of the discharges, and so that I think that will be as limited but useful treatment.
But again, I think this is a typical example, but we can use EpiCARE for, so we have a big network of experts, and then we have also a database, and that score can do automatically this inter-rater agreement analysis of the features. And then the last thing that we would like to talk about is ERICA. And ERICA belongs to Milan. Yes.
So, good morning, ladies and gentlemen, and thanks, Sandor, for giving me the opportunity to give a word about another initiative driven by EpiCARE, Project ERICA, which is an acronym of the European Research Bank of Human Intracerebral EEG. And this idea stemmed from recently expressed called Human Brain Project on Federated Analysis of Human Intracerebral Stimulation and Recording Data. What is important is that this very ambitious project, in which now there is 16 partners, 13 clinical departments, most of them from EpiCARE consortium, and thanks for participating all who are involved. And 3 non-clinical research groups, mainly the theoretical neuroscientists and neuroinformatics from Marseille, Newcastle, and Prague. The aim of ERICA is to significantly improve the pre-surgical stereo EEG interpretation and guide surgical and stimulation strategies, and the vision is to develop a novel approach of patient-specific large-scale brain modeling based on epileptic patient data. What is important that there are altogether 4 tasks, and ERICA has 2 main parts. The first part is to build a research bank or a research database of the patients who preoperatively undergo the stereo EEG investigation. And in this moment, as I said, we've got 13 clinical departments who are keen to share their data. It means that in this moment we probably will be able to dispose retrospectively with about 1,600 patients who were investigated using the depth electrodes, and each year we prospectively can collect more than 250 patients investigated using the stereo EEG, which is amazing, and we cannot have this data without such a project with this consortium, of course. In addition, within this consortium, we will be able to collect also patients with deep brain stimulation, patients not only treated for epilepsy, but also patients treated for several movement disorders. But this is not enough to have just really this large database. The second very important part of the project is the part in which we would like to develop technologies needed to create patient-specific brain models. And what's important that all these data and all this analysis should be integrated into the HVP-based large-scale brain network stimulation platform, the virtual brain. Important is the integration of these database and these analyses into the medical informatics platform of the human brain project. Markus Kaiser from Newcastle should develop the stimulation protocols to treat epilepsy, and all these technologies then should be validated in the mouse model. After 2 years of the project, we would like to build a first cohort of virtual epileptic patient brain models from our database and to contribute to this MIT or medical informatics platform for further analysis. That's all what I want to say now. Thanks.
Any quick question? I mean, I think what this has illustrated, and already we've illustrated, is utilising the network to facilitate research. Yes, it's a clinical platform, and yes, we haven't got resource, but actually this is an example of applying for more resource to do research, from which the consortium has contributed, and the same for SCORE. And I acknowledge everyone's going, where's the resource? But actually by bringing the consortium together, then there becomes a facility to create a database and apply for more resource. So I think it's a good illustration of the clinical research interface, so thank you very much. And you know, you're around all day, so people can talk to you, so that's fine. Okay, so Christoph.